Good afternoon, Renee. How are you doing today?
I'm alright.
On a scale of from 0 to 10, with 0 being distressed and 10 being extremely distressed, I mean 0 being not distressed, I'm sorry. Where would you say you are right now?
Probably like an 8. I haven't been sleeping well.
Okay. Well, we're going to go ahead and discuss your sleeping disturbances a little bit later, if that's all right. Did you do your homework this week?
Yes, I did.
Excellent. Do you want to go over it?
Alright.
Which situation did you write about?
My old boss called me on Monday and wanted to discuss me coming back to work.
What did you think or imagine after hearing that?
That I'm weak for not being able to take back my old job because I would have to drive on the freeway. I imagine getting on the freeway and my palms get sweaty.
How does that make you feel?
Nervous and stressed.
Okay. What makes you think that what you thought and imagined was true?
Because there are car accidents on the freeway all the time.
What makes you think it was untrue?
Well, I could be over exaggerating.
Okay. What's another way you could look at it?
That would be nice to work again, and I don't like being home all the time. It was nice to hear from my old boss.
Okay. Well, what's the worst thing that could happen, and what could you do then?
The worst that could happen is I accept my job back and I get into an accident on the freeway on the way there, and I could have a panic attack or something.
Okay. Well, let's touch on something differently. What is the best thing that could happen?
I can make it down the hill just fine and be back to working at the job that I love.
Okay. What do you think will probably happen?
That I'll turn down the job offer so I can stay up the hill and away from the freeway, and I can start applying for jobs that are closer to home that pay less.
Okay. What would happen if you changed your thinking?
I don't know. I guess I can get my job back.
Okay. What would you tell your best friend Maria, your friend Maria we discussed, who lives down the hill if you haven't seen since the accident? What would you tell her if this happened to her?
Um, I would tell her that she should take her job back because it paid well and that she should work on driving on the freeway again. Maybe she should move down the hill eventually so she can be closer to work.
Okay. Interesting. What should you do now?
I wrote that I should start practicing the exposure activity we talked about.
Excellent answer, Renee. It appears that you processed that really well, that worksheet. Last session, we made the in vivo hierarchy. Do you remember that?
Yes, it made me feel better that I'm not the only person that suffers from it.
You said you avoid going anywhere near the freeway. You stated you won't even drive by the freeway. When I had asked why you said that, it was because the freeway makes you panicky and gives you flashbacks to the accident. We then discussed the acute stress disorder and how it's affecting you. And you absolutely aren't alone in it. With your fear of going over the freeway, we identified one safety behavior, which was your mother. If you confronted going near the freeway with your mother driving, you feel that you could ease into driving near the freeway and eventually on it alone. It's essentially how we developed your goals. Do you remember that?
Yes, I think for me, I just get really high anxiety when I go near the freeway, but I want to learn how to drive near the freeway and on the freeway so I can get back to my job. It's only when I'm driving on the road that leads to the freeway when I start thinking about the freeway and I get panicked. I'm fine driving around town. I don't suffer any anxiety from that. That is the only thing I avoid since the accident, but it is a big deal.
I understand that you feel it's a big deal. Do you recall what the exposure activity was that I mentioned in our last session, session 3?
Yes, that I would think about driving near the freeway and practice the breathing exercises that we worked on.
Excellent. And what were those breathing exercises?
We worked on the relaxation breathing, which I wrote down.
Excellent. Could you please share what you wrote down?
Sure. That I have to find a comfortable spot to sit, that I have to focus my attention on the way I breathe and listen for a pattern. That for 2 seconds I breathe in slowly, and then for 4 seconds I breathe out slowly. Then I tell myself repeatedly to relax, and I continue this until my breathing stops.
Why did your breathing speed up?
Because I'm thinking about the accident and reliving it.
Okay. Would you like to practice your breathing exercise now?
Yeah, I think that would help.
Okay, excellent. Go ahead and get comfortable in your seat. Take as much time as you need. Okay. You comfortable? Okay, excellent. Do you recall in our last session that I'm going to record your story?
Yes, I do.
Excellent. Are you still comfortable with me recording?
Yes.
Okay.
Whatever that can be done to help me is all right. I'm used to it.
Okay, let's begin. Renee, I would like you to please explain, in as much detail as possible, the morning of June 9, 2009.
Okay. It was around 7 a.m. I was on the freeway, headed down the hill to drop Grace off at daycare before heading to work. It was a very foggy morning, and that made me very nervous. It sometimes got very foggy in the morning, but this time it was the worst I'd ever seen. I turned on my fog lights and I focused on the car in front of me. When I got down the hill, the fog got thicker and I lost the tail light of the car I was following. That was when I heard the crunch of the metal. I knew I was about to get in an accident because I could not see what was in front of me. I hit the bumper of the white van. That was when I felt outside of myself. I heard the shattering of the glass that was my passenger window. I could see Grace crying in the back seat. I felt the left side of my head hit the driver's side window. I could hear the screeching of the brakes behind me. When the car hit me from behind, the airbag went off and I hit my arm on the center console. It felt like a couple of minutes later, someone was opening up my driver's door and asking me if I was all right. I still felt like I was in a dream or not in my body, and it doesn't make any sense. Their words were a blur, like I was underwater. It took me a few minutes to realize someone was helping me. Once I came to, I started screaming, asking about Grace. I had such an intense headache and I could feel the warmth of the blood running down my head. So from there, someone from the outside of my car said that she was all right. At the time, I didn't realize that it was a paramedic talking to me. I was guided to an ambulance and taken to the hospital for a CT scan to make sure that my head injury wasn't serious. Grace was brought into the ambulance by a paramedic who held her the entire way. My CT was clear and Grace suffered no injuries. I was sent home for two hours later. My mother picked me up. I couldn't sit in the front seat during the car ride because I was so nervous. Reliving that whole thing is really starting to make me freak out. I'm really freaking out. Like I can see it. Is it hot in here?
Okay, Renee. Renee, I'm gonna ask you something right now. Okay, let's go. Can you tell me what color that lampshade is?
Like a tan, like a white, like an off-white tan.
Okay, and where's the lamp? Where's the lamp sitting?
It's on the floor.
Okay.
On the carpet. It's on the carpet on the floor.
Okay. What color is the lamp?
It's silver. Yeah, it's silver.
Okay. Go ahead and close your eyes for me. Okay.
Yeah.
I want you to focus on your feet on the floor.
Okay.
Okay. Do you feel them?
Yeah.
Okay. Where is the sensation at right now?
It's like in my heart, like in my chest.
Okay. Just continue to breathe. I want you to feel the pillow behind your back, and I want you to feel the couch. Tell me what that feels like.
It feels comfortable. It feels relaxing.
Okay. All right. I'm gonna have you open up your eyes.
Okay.
Let's go ahead and practice your breathing exercises. Okay.
Yeah. Yeah. That's fine.
Okay. Breathe in slowly for 2 seconds. 1, 2. Breathe out for 4 seconds. Remember what you say to yourself.
Relax.
Excellent. Try it again.
That's scary.
Yeah, that's gonna be pretty common for a little while.
Okay.
Okay, that's perfectly normal.
Yeah.
What you're going through.
Okay.
So we're gonna keep continuing to do things like that.
Okay.
The method I just used with you is what we call grounding.
Okay.
This is something I think I want you to start to do when you're at home. When we start going through these activities,
Yeah.
we want you to focus on something in the room.
Okay.
Focus on the sensations.
Yeah.
Focus on things that you're going through. We want you to very much try to do something like that.
Yeah.
Okay, it's gonna help you center yourself a little bit better. There's actually something. Let me get something off my desk real quick. There's something I want to do with you.
Okay.
Okay. This is called a progression muscle relaxation. I feel like this is really going to help you right now. Okay. So it's an exercise that's used to relax your body and your mind. And basically, we're going to have you tense and reflex your muscle groups over your entire body.
Okay.
By doing this, it's going to start to release a little bit of that tension in your body, get you just relaxing a little bit.
Yeah.
That's what we want.
Yeah.
Because the way that you just reacted, we want to work towards getting you, a little bit more relaxed.
Yeah.
And we're going to get there.
Okay.
This is something we're going to work on.
Okay.
So, okay. So I want you to get in the most comfortable position possible right now. All right? Okay. Allow your attention to focus only on your body. If you begin to notice your mind wandering, bring it back to the muscle you're working on.
Okay.
Now I would like you to please take a deep breath through your abdomen. Hold it for a few seconds and exhale slowly. Again, as you breathe, notice your stomach rising and your lungs filling with air. As you exhale, imagine the tension in your body being released and flowing out of your body. And again, inhale. And again, exhale. Feel your body already relaxing. As you go through each step, remember to keep breathing. Tighten the muscles in your forehead by raising your eyebrows as high as you can. Hold for about 5 seconds and abruptly release, feeling that tension fall away. Pause for about 10 seconds. Now smile widely. Feel your mouth and cheeks tense. Hold for about 5 seconds and release, appreciating the softness in your face. Now tighten your eye muscles by squinting your eyelids tightly shut. Hold for about 5 seconds and release. Gently pull your head back as if to look at the ceiling. You're already doing an excellent job. Hold for about 5 seconds and release, feeling the tension melt away. Now, feel the weight of your relaxed head and neck sink. Breathe in and out. In and out. Let go of all the stress. In and out. Now, tightly but without straining, clench your fists and hold in this position until I say stop. Hold for 5 seconds and release. Now, flex your biceps. Feel that buildup of tension. You may even visualize that muscle tightening. Hold for 5 seconds and release. Enjoy that feeling of limpness. Breathe in and out. Now tighten your triceps by extending your arms out and locking your elbows. Hold for about 5 seconds and release. Now lift your shoulders up as if they could touch your ears. Hold for about 5 seconds and release. Feel the heaviness as you release that. Now, we're going to have you tense your upper back by pulling up your shoulders, trying to make your shoulder blades touch. Hold for about 5 seconds and release. Excellent. Now tighten your chest by taking a deep breath in. Hold for 5 seconds and exhale, blowing out all the tension. Very good. Now, tighten the muscles in your stomach by pressing in. Hold for 5 seconds and release. Gently arch your lower back. Hold for 5 seconds. Relax. Feel the liftness in your upper body, letting go of the tension and the stress. Hold for about 5 seconds and relax. Next, I'd like you to please tighten your buttocks. Hold for about 5 seconds. Release and imagine your hips falling loose. Next, I'd like you to please tighten your thighs by pressing your knees together as if you're holding a penny between them. Hold for about 5 seconds and then release. Now, if you could please flex your feet, pulling your toes towards you and feeling the tension in your calves. Hold for about 5 seconds and relax. Feel the weight of your legs sinking down. Next, I'd like you to please curl your toes under your tensing feet. Hold for about 5 seconds and then release. Now, I would like you to imagine a wave of relaxation slowly spreading through your body, beginning at your head and going all the way down to your feet. Feel the weight of your relaxed body. Breathe in and out, in and out, in and out. And give you a couple more minutes of deep breathing. Okay. When you feel comfortable, you can go ahead and sit up. How do you feel now?
Way better. Yeah. The anxiety is like all gone. Like the tension and the racing heart and sweating and everything is gone.
Good. we're going to go ahead and incorporate this into our sessions also, along with your regular breathing.
Okay.
I feel that it's going to be very good just to get your body, a little bit more relaxed.
Yeah.
I found that you responded really well to it.
Yeah, I feel way better now.
Good. Yeah. So we're going to go ahead and rate you one more time on that scale.
Okay.
When you were at the peak of right after you said the story, where do you think you were from 0 to 10?
Like a 9. Yeah.
Okay. Yeah. And how were your symptoms then at 9?
Like really racing heart. Like my thoughts were all over the place. I couldn't really have a clear thought, and like my muscles were really tense, and I felt like I was like having a hard time breathing, and I almost felt like I was like blacking out again. Like I wasn't in my body anymore.
Okay. And then now, how do you feel?
Probably like a 5, like 4.
Good. Yeah. Good. That feels really helpful.
Yeah, I feel really relaxed right now. So that's helpful.
Okay. Excellent. Are you ready to move on?
Yes.
Okay. Great.
So,
is there anything else you'd like to add about the event?
It was just, I just couldn't handle it. I was freaking out. I was in a state of panic. My whole brain just shut down. I felt like my whole brain shut down, and my world was like colliding around me, and I couldn't think. I couldn't breathe. I don't even think I could move. It was overwhelming.
It sounds like it'd be overwhelming too. I'm going to go ahead and stop the recorder now.
Okay.
All right. Thank you for telling me your story again, Renee. Now, if you could practice those breathing exercises we worked on. Let's go back to it. I'm going to walk you through the first one, and then we'll let you do the other ones by yourself. Okay, we're going to breathe in for 2 seconds slowly, and then breathe out for 4 seconds.
Relax. Okay, I can do it. I feel better.
Okay. How do you feel better?
I feel like my heart rate has slowed. I can breathe easier. Like my thoughts aren't racing like they were before.
How does that help you?
It makes me think that if I try to do my breathing activity at home, that I might be able to drive near the freeway this week or maybe next week.
Okay. And how do you think you're going to achieve this?
My mom will drive me, and we can go to the McDonald's by the freeway, like right there, right next to the freeway.
Okay. How do you feel about that?
I think as long as I'm not the one driving, that it might be tolerable. My mom always knows how to calm me down too. So if I do get worked up, maybe she can calm me down.
Good. Okay. Do you feel that it'd be easier if you imagined going to McDonald's first?
Yeah, I think it would. Tomorrow I can imagine it, and then maybe this weekend I can try it.
Do you think you can try it, or can you try it?
I think I can try it.
That's good. Do you remember the goals we created in your second session?
Kind of. I think I wrote them down, but I didn't bring them with me.
Okay, that's fine. So the first goal we discussed was to decrease your anxiety symptoms by driving near the freeway for 5 minutes twice a week after session 4.
Yes, I remember that.
Okay, excellent. The second goal was to get on the freeway from Palmdale Road and exit on Bear Valley Road, about 2 miles away, once a week after session 6.
Yeah, I'm not sure I'm ready for that one yet.
Okay, of course. The third goal was to drive on the freeway until the Main Street exit, about 7 miles away, one time between sessions 7 and 8.
And then after that, I drive longer the next time, right?
Yes, exactly. We're aiming for your 10 weeks of treatment, as we discussed before. By the end of your 10th session, what we're hoping to get is that you're able to drive on the freeway from your home to your old job one time after practicing your relaxation exercises.
I'm glad that one is further down the road. I don't think I could do that one for like a long time.
Well, that's understandable. How do you feel about all of this?
I feel stressed thinking about him.
Okay. Well, let's go back to that scale that I opened up with. On the scale of 0 to 10, where would you say you are right now?
Mm, probably like 6.
Okay, so a little bit better than when we first met.
Yeah,
Okay,
it's gone down.
in the beginning. Okay.
Yeah, a little bit.
How would you describe your symptoms at level 6, though?
Like I'm pretty stressed, just the fact that we're thinking about the freeway and talking about the freeway, but not so stressed because like I can't see the freeway from here. I know that it's not close by and that I'm not gonna have to drive on it, so it's like reduced a little bit.
Okay. How would you define stress?
Probably like I define it as breathing heavily, sweating a little bit, and not being able to think straight. And I'm probably not sleeping well. I definitely don't sleep well.
Okay. Those definitely are signs of stress and anxiety. It's really common with the condition you're experiencing. If you recall, in week 2, we said that you were diagnosed with acute stress disorder. So
Yeah.
that's what we're working on. For the first 3 sessions, I wanted you to challenge your dysfunctional thoughts about the freeway, and that's what those activities are all about.
Right.
How did you feel about those homework sessions?
I like them. At first, I was nervous because I didn't want to drive my car. And after the second session, I was ready to drive locally around town, just get some errands done and stuff. I think it helped me not to be scared about being in my new car. You know, like that the environment in my car wasn't as scary after a while.
Okay.
It was good.
How do you feel that it helped you?
Well, once I wrote it down, it didn't seem to be scary to me anymore.
Excellent. And then how did you move on from that?
I started the next session working on driving around town.
Okay. And then you feel that the worksheet still helped you at that point?
Yes, it was the same as before. It made me less scared, and then I wrote it down on the paper.
Okay, great. I feel that you're progressing really well so far. You'll be doing a different homework assignment after this session.
Oh, what's my next homework assignment?
Well, I'm glad you asked. After this homework session, you'll do a worksheet every day, like the one that you've done before. But this time it's a different worksheet, but it still gets you thinking. Like we call it exposure treat, exposure homework.
Okay. Well, what's exposure homework? That sounds kind of scary.
Well, it's not. The first homework assignments were challenging your thoughts. And that's what the dysfunctional thinking was all about. We discussed that in our second session. These homework assignments are more about putting your thoughts into action,
Okay.
in a sense. How would you feel about practicing with one right now?
I think I'd like that.
Excellent. Okay. Well, I'm going to look this over with you. What is your feared situation?
Driving near the freeway, definitely.
Okay. And the next portion on this worksheet is what is the exercise you'll do?
Drive near the freeway twice after this session.
Excellent. Your first goal. How long?
5 minutes.
Very good. Now, the next portion are your thoughts.
I guess I won't know my thoughts until I do it.
Excellent. I really like how strongly you stated that. The following part of the homework sheet is to rate your anxiety levels from 0 to 10 in the exact same way that you would rate your stress that we open up with every class. Then you provide your comments. Do you feel this is something you could do?
Yeah, I can do that.
Okay. Say that again, only louder.
I can do that.
Good, good. How did that make you feel?
Good. It felt really good.
Did you notice your smile when you said that?
Yes, maybe too.
Where did you feel that sensation?
On my cheek.
Very, very good. Earlier, you had mentioned that you were having sleep disturbances.
Yes.
Can we take a moment to talk about that?
Yes, I have been having sleep disturbances. I've been having nightmares about the accident, kind of like reliving it. In one nightmare, I could actually smell the hot metal and the rubber.
What did you do after you woke up?
I woke up sweaty and crying, but I tried to do the breathing exercise. It was just, it took me a minute to remember to do that. I was kind of in the moment, you know.
How long did it take you after you did your breathing exercises?
Just a couple minutes.
Okay.
Yeah, 2-3 minutes.
Good, good. Okay, and did it work?
Yeah, it helped me get back to sleep eventually, but I had to pace the room a little while and drink some tea. I also walked into Grace's room and held her hand while she was sleeping. The worst part about the nightmares is that I am reliving the accident with all my senses, and that's horrifying. But I tried to calm down by thinking that it was just a dream, you know. I kind of thought, what would I tell Gracie when she has nightmares? And kind of tried to go through it that way.
Excellent. I think that's a perfectly acceptable reaction.
Yeah.
You appear to have handled it well.
Yeah, I think it went well. I hope I don't have any more nightmares this week.
Okay. Well, if this is something you ever need to discuss, we can bring that back and maybe track your nightmares and try to get that down also.
Okay.
How do you feel about today's session?
I liked it for the most part.
Okay, what didn't you like?
Um, it's just hard talking about the accident. You know, like I don't like talking about it, but I know that I have to.
Okay. Why do you think we talked about the accident?
So I can handle my breathing better.
That is part of the reason, yes. You're practicing your breathing so that you can relax, which will allow you to cope with driving on the freeway again.
That makes sense.
What did you like about the session?
I like working on the breathing exercises because it helps me.
Okay, good. For your homework after the seventh session, just going a little bit further into the future, I'm going to have you do exposure for just a little bit.
Okay.
And then we get to the seventh session, I'm going to have you listen to the details of your accident that we recorded today, once a day, and record your feelings and fulfilling your second goal, which is getting on the freeway. How does that make you feel?
Ooh, this is makes me feel a little nervous.
How so?
Because I can anticipate that I might start hyperventilating while listening to the story.
And what do you do when your breathing starts getting out of hand?
I practice my breathing exercises, which helps me.
Okay, excellent. Before you leave today, will you please be sure to complete the worksheet that you given me at the end of the session?
Sure, that's no problem.
Okay, I'm gonna step off for just a moment and kind of talk about why we're gonna be doing that homework with having you listen to the video.
Okay.
It's just another part of we talked about before the prolonged exposure and what
Right.
we're working on. We're gonna have you listen to that recording, and a lot of research points to the fact that it desensitizes you in a sense. Like it
Yeah.
kind of gets you listening to it a little bit more.
Yeah.
And it gets you to process it better. So that's what we're kind of hoping for the seventh session, and that's why we have our goal mixed in there during that same time,
Yeah.
is that we want to try to get you to just do a very small portion.
Okay.
And we had mentioned before that a good change agent for you is going to be your mother being
Yeah.
there in the car driving. We want to eventually get you in the driver's seat, but
Okay.
we're going to work out to that for sure.
Okay.
So having your mom there is definitely going to be very, very good for
Yeah.
what you're trying to go through right now.
Yeah.
So with this particular exercise, this is going to help you desensitize a little bit of that accident and get yourself getting up there to get on the freeway for a little bit.
Yeah. Okay.
So do you have any more questions before we close?
No, I mean, like, I think the only question is if I'm feeling scared, can you slow it down, or does it have to be like at a certain pace?
Oh, absolutely. We will go at whatever pace is comfortable for you.
Okay.
It took us a little while. Remember our first session? You were very like, I won't go near the food. I don't want to be in the car.
Yeah.
You know, it was very difficult for you to
Yeah.
get to me in the first place.
Right.
And then we had opened up by doing that first homework activity to just kind of get you a little more comfortable being back in your vehicle again.
Yeah.
It's something new. I think that helped being in a new car. It didn't bring back as much trauma. Um, so we've been taking baby steps, which baby steps are not a bad thing at all. So,
baby steps.
especially with what you went through, it's completely understandable. And like I mentioned before, you are definitely not alone in this. People go through this all the time, and that's the process of coming to see me and working through this exposure just to try to get you to be comfortable. So if we get to the seventh session and you feel that you're still not ready, we might extend your session to 12, like add a couple extra sessions.
Okay.
Give yourself a little bit more breathing room. So we're setting a goal at 10. We will go past that if we have to get you to where you need to be.
Okay, that makes me feel like less pressure on myself. So,
Excellent.
but I'm gonna try and make the goal.
And have you felt comfortable again having Gracie in the car with you?
Yeah.
Or what was a big issue?
I think I like only having Gracie in the car when my mom's there because I feel like at least there's somebody else protecting her and looking out for her safety in the case that I do get in another accident. That she's protected because that is my major concern a lot of the time is that if I get in an accident, that's one thing. You know, if I have a panic attack, who's gonna take care of Gracie? So yeah, I like to have another person around.
I remember your first week you were with me, you were saying your nightmares were really based on her being hurt because that was what when you came to in a sense, when you came back into yourself after that accident, that was your first concern was what had happened to her.
And the fact that, I wasn't there to help her and that a medic had to take care of her and it just I don't like being out of control when it comes to her safety.
And have you done a follow-up since then to make sure you're still good with your head and everything's fine?
Yeah, they said that everything's good. I think they just they said that I just had a minor bruise on my skull, but I'm okay. Gracie's okay, and we're all gonna be
Good.
physically we're all good.
Good.
Yeah,
Okay.
yeah. So
Good. And how has your mom been helping you through this?
she's been amazing. Like my mom and I are very close, and like I said, she's one of the only people who can really calm me down. So I've been really lucky that she's been able to help me through this process, and I've been trying to inform her of everything that you and I do, and she's been a good partner in that. And so yeah, thank God for her. Cause,
And just know your mom's always welcome. I know she hasn't been attending in a session because she's taking care of Gracie while
yeah,
you're here.
yeah,
But if there's ever a time, she's more than welcome to be here so she can see the whole process
yeah,
also and just kind of be involved.
yeah.
She's gonna be a really big factor until you're ready to get on the freeway.
Yeah, I'm so lucky to have her, and I'm excited to not need her anymore. But for right now, I'm lucky.
Yeah. Have you spoken to your best friend Maria? I know she's down the hill. You haven't gotten a chance to see her because of everything.
I feel bad, but I kind of avoid her phone calls because I know that she's gonna invite me to hang out, and I'm like kind of embarrassed to say that I can't drive down, and I know she's not gonna want to drive up and see me, and it's just one of those things where I do kind of text her once in a while, but I just until I feel more comfortable being able to drive and see her and less embarrassed about my situation, then I think I'll talk to her more about what's going on.
Does she understand a little bit about what you're going through?
Yeah, she knows that I'm scared, but she's kind of one of those people who like just work through it, you'll be fine, and she's not as understanding as like that it'll take time. So she just wants it to be easy and come see her like I always used to. She doesn't understand that things are different now because of the accident. So I was able to drive the field before, but it's different.
Okay. Well, I actually heard just like a few days ago that they might be starting a support group. Kind of, there was a lot of victims. I don't know if you're aware of this, but there was about 60 people that were involved with this particular accident. I know that there's some locally and there's some down the hill, and they're going to try to do a support group. So, I mean, when they get that information, if you'd be interested, I think that'd be really good also. Just to have somebody who's been through the same thing as you to just kind of help you through this together. So
really nice.
Yeah, so we're aiming for something like that. I feel that if you're continued on this treatment and then with your support group, I feel that it'll just really round you out. So we want to, as I said, we want to shoot for 3 months down the road where you'll be able to get back there and keep in contact with your boss. I know she's being really sympathetic towards what's going on. She was really for your treatment. I spoke to her on the phone. Um, she really wants to be involved with everything. She wants to make sure you're okay. I know that losing you was a big hit for them because you're such a great employee. So they really want you to get better so you can come back to them eventually. So.
Eventually, I would like to go back. I mean, I love that job and I loved everybody who worked there. So that's like kind of like an additional loss for me is not being with all my friends and my colleagues and working every day. So
absolutely. And I remember we looked into your options. We looked into possibly going by train. There were some issues there. That train drops off like miles away from work. It would have been so. I know we had discussed other modes of transportation to get down the hill. And I know that was a big issue. I know a lot of commuters. That's the thing for them. Anyways, is the traffic, and then you just have the one freeway here to get there. So it always makes travel a little difficult. And then, of course, given what has happened, add that on top. It just makes it.
I know. I know. So I'm gonna work. I'm gonna come back.
You're doing excellent. I really appreciate that you've been doing your homework. I know it's a lot of writing, but I feel like it's really good for you because you have these thoughts and you're just trying to work through them and get through them together. And then I only have you read one because I want you to really process those, but I want you to bring in just one here. If you want to go over every single one of them, we can do that as well. If that'll help you. With this dysfunctional thought, the worksheet that I'm going to be giving you, I'm sorry, the exposure homework. When we get to that point, we're going to write down your third situation. We're going to go from there and just kind of work our way up also. So this is what the exposure worksheet is going to look like for you.
Cool.
So we had mentioned your first situation was going to be getting on the freeway again. We might even go a little bit backwards and just near the freeway as your first gear situation.
Yeah.
And then we'll go from there. So
Okay.
we're going to base your first worksheet on just getting
Near.
your first goal, which was your 2 times near the freeway.
Yeah. Yeah.
And then, like I said, we're going to move up from there.
Okay. Yeah, I can see how that works. Okay, cool.
Yeah, so we'll discuss that at our next session, session 5.
Mm-hmm.
And if you have anything in the meantime that you need, if you don't have any more questions, then I will definitely see you for our next session.
And then I'll give you this evaluation to the lady at the front desk.
The receptionist, yeah, absolutely.
Okay.
And that goes in your file with everything else. So we're just trying to track, make sure that I'm engaging with you, you know, that you're feeling comfortable. Because what you need to do is trust me that, you know, that's what I'm here for, is to get you to where you need to be. So that's the most important thing.
Okay, cool. So I'll fill this out and then I guess I'll see you next week.
Excellent. Okay. Thank you so much. Goodbye, Renee.
Goodbye.
26 minutes.